Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
And Dr. Morris Kelley with St. Vincent Heart Clinic, Arkansas is joining us today. We're talking more about peripheral arterial disease. Good morning, Dr. Kelley. Thanks so much for coming in.
Good morning.
It is Heart Month, so we've been talking about things like this all month long. First, let's talk about PAD. What are some of the signs that someone may have that is significant enough for them to get checked out for something like this?
All right, so symptoms of peripheral artery disease begin with cramping or pain, tenderness in the legs. This is usually brought on by exertion, some form of walking or climbing stairs. It's usually pretty reproducible in that patients will say that if I walk a block, I get these symptoms. If they sit down and rest, it goes away. If they walk that same block, those symptoms come back. They may also complain of coldness in the legs or symptoms like that. They may also have an ulcer or sore on their foot or leg that doesn't seem to be healing as well as they think it should be.
Okay, you're talking about recurring things too. I think that's the main thing to keep in mind.
Right.
Is it the same pain over and over again? It could be more severe at any point. And if it does get more severe, is that even more of a sign that they need to seek help immediately?
Absolutely. So we call it claudication when they walk and they have those same symptoms every time they walk a certain distance, which kind of distinguishes it from arthritis, which may kind of come and go, may not be as bad each time. But with peripheral artery disease, it's usually the same pain at the same distance, and it gets worse over time.
Talk about the importance of diagnosing it and treating it, especially early on.
Right, so peripheral artery disease puts you at a 4 to 5 times higher risk of developing stroke or coronary artery disease, and so it's very important that we get that checked out as soon as possible. Also, because we're talking about ulcers, those things can get infected into the soft tissue, into the bone, and so you want to get that treated as soon as possible to avoid getting infection that could cause or lead to an amputation of your foot or amputation of your leg.
Looking at the risk factors, I think one thing that stays true every time we have someone come in and talk about heart disease or any type of issue with the heart, big risk factor always starts with smoking.
Always starts with smoking. Smoking is the #1 risk factor. It's the most modifiable risk factor, and that patients can stop that smoking and decrease their risk by the greatest margin. But also diabetes is also a risk factor. Both smoking and diabetes cause damage to the blood vessel, which increases your risk of developing blockage in the artery. High blood pressure, high cholesterol, the same things we've been talking about all month.
We talked about a moment ago when someone's feeling these same pains over and over again when they're walking or doing any kind of exercise. How do they come in and get diagnosed medically at a doctor's office?
Right, so the main thing is it starts with the patient. The patient has to recognize their symptoms, recognize that they have that sore. There's a couple of tests that can be performed in the doctor's office. One starts off with an ABI, or an ankle brachial index, which is basically measuring the blood pressure in the arm, comparing it to different levels down the leg to see if there's a drop off of pressure, which would suggest that you have a blockage in the artery.
Okay.
Those tests can be performed in the doctor's office. The next step would be to do an angiogram, which can be performed either in the hospital or in an imaging center. It's basically the dye test where we inject dye, watch it flow down the arteries to see if there's a blockage that we can visualize.
What about treatment options after that if someone is diagnosed with PAD?
Right, so a couple of treatment options. One is angioplasty, where we actually go in with a catheter, which is a small plastic tube with a balloon attached to it, get into the artery, get to that area that's blocked off, inflate that balloon to open up the blood flow. Other than that, there's surgical options similar to what we do in the coronaries, and that we can bypass that artery, put in an artificial vessel that will get blood flow back around the vessel back to where it needs to go.
All right, and this is the most important thing we talked about is diagnosing this and making sure you get to a doctor as soon as possible if you do experience those symptoms that we spoke about. If you need to contact the doctor's office or specifically St. Vincent Heart Clinic, Arkansas, you can call the number on your screen to set up an appointment, and they are located right there off Canis Road. Dr. Kelley, thanks so much for coming in today. Appreciate that.
Appreciate it.
All right.